you've been doing this wrong. Top 10 mistakes you do in dental care. I'm Dr. Olga Dolghier here at Palm Valley Pediatric Dentistry and Orthodontics. I am board certified pediatric dentist and laser certified dentist. A lot of people subconsciously using their teeth for different purposes. They're breaking their teeth, they're getting gum recession, they're having jaw problems, and they're doing it over and over and over again without even thinking that they are creating damage to their own mouth and to their own teeth. So let's dig in. Let's see top 10 mistakes people commonly do. If you watch this video till the end, you might see yourself doing that over and over again, and your reason why you keep breaking that back tooth every time. Number one reason is actually using your teeth as tools. Believe it or not, people using their teeth to open water bottles, to open Amazon packages, try to open something you shouldn't even touch. We see it all the time. For example, a teen comes in with a broken central incisor. What did you do? I'm asking him, well, I had that package and I wanted to open it very quick. I didn't have scissors, so I pulled it and broke my tooth. Very common. Don't use your teeth as a tool, because your central incisors, your front teeth, actually very thin on the edge, and that edge is so easy to break because it's fragile. Your teeth are stronger than your bones, but they are fragile. So direct hit, forceful pull can damage your teeth permanently. Enamel does not grow back, so you have to be very careful. Number two, you are actually not flossing right. You have a piece of meat, for example, stuck in the back, and you are trying to use something what's not designed for your teeth and get that piece out. Instead of using floss, you are picking up some kind of little plastic piece and trying to dig in. And what you're doing, you are actually digging that piece of meat deeper and deeper into your pocket, creating a periodontal pocket. Then you have gum inflammation, and then you see us, dentists, and trying to figure out what's going on and why do you have a problem. So if you unintentionally trying to clean in between your teeth without using normal dental floss, don't do it. Think about it. Maybe have a pocket floss or a little flosser. Be gentle when you floss. Don't go too deep, because you actually can create periodontal pocket or create gum recession. Number three, you using very abrasive toothpaste, whitening toothpaste, charcoal toothpaste. All this toothpaste and actual baking soda as well, they are very abrasive. So every time you brush your teeth, you are removing enamel from your teeth. So yes, your teeth look beautiful and white right away. Why? Well, you just brushed off half of the thickness of your enamel. So be careful with abrasive toothpaste and with aggressive toothpaste, whitening toothpaste, because it makes your teeth very sensitive. A lot of times you have to be gentle with your enamel. You want to preserve that superficial layer. You want to get calcium to the enamel. You don't want to take it off by abrasive toothpaste. Number four is using too much toothpaste. I always ask parents, how much do you put on a toothbrush? And a lot of times it's way too much. You see that commercial of Colgate with a big piece of beautiful toothpaste on a toothbrush. It's for 5 use. It's too much toothpaste with that one toothbrush. So remember, if your child, for example, cannot efficiently spit out, you put a grain of rice. If your child's 3 to 10, you can put a pea size, and for adults, pea size still works. It's enough toothpaste. You just need to use to create and remove the plaque all over your mouth. That big piece of toothpaste you absolutely don't need. Number five, using mouthwash all the time. So we have some parents or kids who actually very concerned about smell from the mouth. They smell the odor and they're making the kids constantly washing and washing and washing your mouth using mouthwash. Some mouthwashes, they do have alcohol in them. And if they do have alcohol in them, it's actually irritating for the mucosa of your mouth, and it also kills all the good bacteria and bad bacteria. Guess what? If you kill all the bacteria, the bad ones grow faster than the good ones. Look at the labels, talk to your dentist, figure it out what mouthwash is the best for you, because some of them are great, but some of them not so good. So you have to be mindful of how much mouthwash do you use. Very, very important. Another mistake you make is chewing on one side. For example, you have a sore tooth on this side, you're gonna chew on this one over and over and over again. What happened in this case, if I see you or your child at that time, a lot of time you'll have a calculus build up on this side. If you don't use it, you lose it. It's actually true about this process, because if you're chewing only one side, you're overworking your TMJ, you're overwearing your teeth, your teeth become more flat. And this side, since you're not using it, it's actually not symmetrical. So try to move the food bolus from one side to another. If something bothers you on this side, address this. Don't push it under the pillow. You need to talk to your dentist. Figure it out why you're chewing on one side, not on the other side. Another common mistake is trying to feed the kids only soft diet, or they eat soft diet more than normal, regular diet. Evolutionary. We used to eat hard foods. We used to bite into meats. We used to chew hard different foods. And guess what? We never had very constricted mouths. Now we see more and more crowding. Now some kids don't even have wisdom teeth. So evolutionary, our jaw becomes smaller, our faces become longer, and our airways become more narrow. It's all interrelated. By eating a lot of soft food, we're actually changing our genetic makeup long term. So evolutionary is not beneficial for us. So try to eat hard foods regularly. Try to chew, use your mouth. Try to not be afraid of that, because if you're giving your child only soft foods, you're doing a disfavor for them. Some nations, for example in Africa, who eat more like solid foods, more meats, they don't have crowding, they have beautiful smiles. So epigenetics plays a huge role in long-term perspective. So use your mouth properly, chew on both sides, make sure you eat not just soft foods, normal, regular hard foods as well. And another mistake you do is not seeing your dentist every 6 months, because you think, oh, I'll do it later. Oh, I don't have time for this. Prioritize. You should see a physician every year. You should see a dentist twice a year. Why? Because a small cavity becomes much bigger over the 6 months time frame. So something we can catch and fix easily during your 6 months checkup can become a huge problem. You can have a root canal, something major, uncomfortable. And the only person to blame for this is you, unfortunately, because you have to be on it. You have to go every 6 months to make sure you do not miss small cavities which grow into a big cavity. So think about it. Do you make those mistakes? Share with us. Let me know. Thank you so much for watching. Stay tuned for more videos. Bye!